Hello and welcome. This is Joe Valenzuela with Vista Mutual Insurance Services. Let's talk about Original Medicare and why it's not enough insurance. Okay, so Original Medicare is Medicare Part A and Medicare Part B. Part A is designed to cover you while you're in the hospital, and Part B is designed to cover you while you're outside of the hospital for your regular doctor services. So Part A you get, or usually most people get for free from the government when they turn 65 or have a disability, and they have to have met some criteria, be a U.S. citizen, have worked at least 10 years in the U.S., so 40 credits, and paid FICA taxes during those times. Now, it could be also a spouse that helps you qualify for this. So if you're married to someone that did that, you also qualify underneath them. So most people get that premium free. Then you have Medicare Part B, and most people do pay a premium for that of $164.90 per month, unless your income reaches a certain level, and then you'll have to pay more. It's called the IRMA amount, the Income-Related Monthly Adjustment Amount. So that's Original Medicare. That's what you get from the government. Now, there are a lot of gaps inside of Medicare that people choose to get additional insurance to cover. And that's because Medicare can have some very costly gaps that I'm going to explain to you here. The first one is that Medicare itself, Part A and Part B, has deductibles and coinsurances for most services. For example, the deductible for Medicare Part A to go on the hospital is $1,600. And that's even just for one day. But it's also good for day 1 through day 60. So if you stayed 60 days in the hospital, it would still be $1,600. Now, if you go longer than that 60th day, then you pay a per day coinsurance, which is pretty high. And then on the 90th day, it doubles. So it can be very costly to have a really lengthy hospital stay and just have Original Medicare. Almost, $40,000 if you're doing 150 days, which most people don't do, but that's what insurance is. We're insuring the things that may happen. The next biggest thing is the lack of prescription drug coverage. Now, Medicare itself does not cover outpatient prescription medications. When I say outpatient, that just means if you're in the hospital, Medicare will cover those medications that are given to you in the hospital. But if you're getting something from a pharmacy and taking it home and giving it to yourself, that's what's considered an outpatient prescription drug. Now, Medicare does not cover these at all. And if you wanted to get this covered, we're going to talk about how you can fill these gaps in just a moment. There's also no out-of-pocket maximum with Original Medicare. And so when we talked about that scenario of you going to the hospital, maybe you stay the entire year. Because there's no stop loss or maximum amount that you can pay, and they say, okay, you're done for the year, you can pay those co-payments into oblivion. Now, with Medicare Part B, you have to pay a deductible, so of $226 per year. So if you go to your doctor the first time out of the year and they charge you $226 and you just have Original Medicare, you'll pay that full amount. After that, they're going to charge you 20%. That 20% can be not costly if it's a very simple service. Let's say you're just going in for a doctor visit or a physical therapy visit. It could be $20 to $40. But let's say that you have to have dialysis treatment. Now, dialysis treatment is 3 times a week, and it is approximately $5,000 per time. If you're paying 20% of that, you're paying $1,000 3 times a week for 52 weeks because, again, there's no maximum out of pocket. This is why people get these other insurances that we're going to talk about. There's also very limited or almost no long-term care coverage. You only get 120 days in a nursing home. So Medicare itself, in a long-term situation, it does not cover that. There is also the absence of routine vision, dental, and hearing aid coverage in Original Medicare. And when I say routine, that's an important word because there are situations that Medicare does cover some vision things when it's a medical necessity. Let's say that you have macular degeneration or other conditions of your eye, you hurt your eye. That is still covered by Original Medicare. When we say routine vision, that is talking about materials. So your eye exam to check your vision, and then also, and that can include retinal imaging and things like that. And then also the materials that you can get, your glasses, your contacts, and the supplies for those. So that's what Medicare does not cover. So there are solutions to all of these problems, and this is what we do here at Vista Mutual Insurance Services. We present you with all of the solutions so that you can make a good choice about what you want to do. So the prescription drug part, there's Medicare Part D. This is an additional insurance provided by private health insurance companies, and the minimum standard is set by Medicare, so they have to follow their rules and has to be at least this good. Usually it's a little bit better than that. But it's through private health insurance companies. So you can't call Medicare and say, hey, I want to get on Part D. You have to call the private health insurance companies or go through a person like us who is a Medicare insurance broker that represents all the companies they can and will map out the year for you and show you exactly what you can get. So you can get Medicare Part D to fill that gap. Now, there are two ways or really roads to go down. One is to just get Medicare Part D, and also you could add a Medicare supplement plan. And it does kind of just what the name sounds like. It's going to supplement your Medicare, and it's going to pay for those deductibles and coinsurances for you, depending on the level of coverage that you choose. One of the most popular plans is the G plan, G as in George, and that plan states that you just have to pay your Medicare Part B deductible out of the year, and then you pay nothing else. Now, usually these premiums are higher than the other road that you could go down, which is a Medicare Advantage program. Now, with Medicare Advantage programs, they're Medicare replacement plans. So they take over as the primary insurance, and sometimes and usually you'll have to use a network of specific providers and doctors. Now, if we have the other way, original Medicare remains your primary if you have a Medicare supplement plan, and your network is all of Medicare. So it's the widest network available. With Medicare Advantage plans, there are HMOs and PPOs. An HMO will lock you into a network. A PPO will have a preferred network, but then you can still step outside of it, but pay more. Now, with the Medicare Advantage plans, they usually will include things like your dental and your vision at no additional cost, or some have an additional cost for those. And we're also starting to see this with Medicare supplement plans, that some plans out there are including some routine dental and vision to make sure that you have more comprehensive coverage. So in order to get those items, you'd have to pick one of those plans. Now, the good thing about picking one of those plans is if you pick a Medicare supplement plan, you basically pay a very low amount. Let's say you pick the G plan, you pay $226 a year for your Medicare Part B deductible, and after that, you pay nothing. If you go to the hospital, you go to the doctor, you're going to pay zero. Between Medicare and your Medicare supplement plan, the things that you do medically will be taken care of completely. You will have prescription drug copayments and a Part D premium as well if you go that way. With the Medicare Advantage plan, you're going to pay as you go along. There are going to be copayments that are different than original Medicare, usually less, but you're also going to get a maximum out-of-pocket, a stop loss, and usually they're set around $3,000 to $5,000. So that means that during that calendar year, if your total medical expenses reach that value, you don't have to pay any more. So that situation where we had dialysis, if you had the supplement plan, you're just paying your deductible out of the year and then nothing. If you have the Advantage plan, you're probably paying 20% up until your maximum out of pocket, and then you're paying nothing. So in 2 weeks or so of getting that treatment, you will have hit your maximum and not have to pay for the rest of the year. These will also include those additional items too, like the dental and vision, but sometimes Medicare Advantage plans will even include transportation and over-the-counter benefits, meaning rides to and from the doctor, and they'll pay for your multivitamin and your baby aspirin. So there are a lot of different ways to get comprehensive coverage to fill the gaps of original Medicare Part A and Part B, which is 100% not enough insurance for you. So we like to give you all this information so that you can make a good decision about what you want to do in the future. And we hope that decision is not to just maintain with original Medicare, because that would leave you open to some significant gaps and potential financial ruin. If you want to learn more, please comment below. We'll answer all of your questions. Also, share this video with anybody that you can. We really want to engage with our community, and we appreciate you listening and learning from Vista Mutual Insurance Services. I'm Joe Valenzuela. Have a great rest of your day.